Hi, my name is Tiffanie Howes. I am the shelter supervisor at the Colleen Quigley Women's Center, and I've been here for about 10 years now. I started as line staff doing shift work, and then just a little over 2 years ago, I became the on-site support supervisor. We are a state-run shelter, so that makes us a little unique compared to all of the other shelters in the state of Utah. We are the only state-run shelter that remains at this time, and that can be some pros and cons in the work that we do. A few things that we have to do a little bit differently or keep in mind and make our clients aware of is because we are state-run. The state agency that we are run by is DCFS, so we are part of the Department of Health and Human Services. So a lot of people sometimes, and especially in domestic violence situations, and some of the family dynamics and whatnot that can come with that, a lot of people can be really nervous about working with or dealing with DCFS. And one way that we try to at least make people aware of that, we try to be very transparent about the fact that we are run by DCFS, and when we get crisis calls, we get phone calls, and the initial contacts that we have with individuals, we will just be very upfront about that and kind of give them the disclaimer that we are part of DCFS. If there is a domestic violence situation that perhaps there's been neglect or abuse that has occurred in front of children or to children, obviously we're mandatory reporters. And one way that we try to kind of dispel some of their fears in dealing with DCFS is that we encourage individuals to self-report those incidents, especially if it was perhaps the violent partner that committed those acts, not only against them, but perhaps their children or in front of their children, that we encourage people to self-report those things because it can help them especially if there's going to be a custody case, if they're making that final break to remove themselves from this individual, that if they self-reported that, it can be really helpful to them, and it looks good on their part to DCFS that they are doing what they need to do and being protective of their children by making others aware that this has been an issue in their home. Also being state run, we have to conform to all of the licensing and health departments and everything else that we do, but there's a couple of other state agencies that we have to conform to, and that can present some challenges at times, but I think it just makes us a more secure, cleanly facility. Sometimes it's hard to answer to all of those, but it's definitely a pro for our clients. It's not a con to be more clean or more safe, so those things can help, and we really do get some good support from our admin. We just have to do things a little bit differently and figure things out. We've been here in this spot. We are just a house. We've been here since the late 70s, early 80s, and being just a house kind of has its advantages that we manage to stay a little more under the radar, stay undisclosed. And although we are in a rural community, so there are some people, that have dealt with us, or maybe they've had family members that have dealt with us, that they may know where we are, but we do our best to keep ourselves undisclosed, and most people seem to be quite respectful of that. Being in a rural area can also present challenges. We don't have a lot of on-site services, so we have to rely on community partners a lot to be able to work with them and work with our clients to be able to help them access services and treatment, resources, whatever that they may need for them or their children. But it's also an advantage in the rural community. We may not have as many services or as many options, different options for the same service, but we do have that nice rural community, hometown, helpful feeling. We have a really good community that people are caring and kind and willing to help others and help do that, and we build good partnerships with us. So we have that advantage. We do not have public transit, so that can be kind of a difficulty at times. We are allowed to transport clients in some regards, like if they have appointments up north, things like that, to be able to help them out in that regard. But just around town and to be able to go and do the things that they need to do, they often have to just depend on walking. And so sometimes that can be a challenge for some people. Fairly rural, it can be a bit of a walk to some of the resources, the places that they need to go. We try to combat that with, providing a bicycle or, whatever form of transportation that we can come up with and be able to give them a ride when we can. But we generally only have one person on staff, and therefore they can't leave. So that does present a little bit of a challenge, and we're just trying to find our best ways to work around that. We've had taxi services that have come and gone, been around briefly. They were rather expensive. And that's one of the things about being rural that can be really difficult, and sometimes it's a deterrent for people wanting to come here. So we try to be very upfront with individuals about that as well, what the conditions of our area are, what we can and cannot provide, and because sometimes those will impact someone's decision. But we just believe in being very upfront, honest, forthcoming about the pros and cons, about our situation. We are a small shelter. We are 11 beds. Capacity comes and goes on the daily, which I'm sure everyone else experiences as well. It's anybody's guess what you might have from one day to the next.